Hello, and welcome to one of AgriSafe Network's presentations. This one today is focused on stopping zoonosis in its tracks and the prevention of zoonoses. My name is Caitlin Haydett, and I have my master's in environmental toxicology, and I'm currently a first-year veterinary student at Michigan State. I first got interested in zoonotic diseases when I knew I wanted to continue working with animals, and I realized how interconnected human, animal, and environmental health is. So thank you for taking the time today to tune in and listen to this talk about zoonotic diseases. First, I want to start with talking about what a zoonotic disease is. What does zoonotic mean? I know the first time I saw this word, zoo stood out to me, of course, in which I thought of animals. And I think that's really a great way to help you remember what it means. Zoonotic diseases, also known as zoonoses, are diseases that can be transmitted between animals and humans. While some may exist within an animal population usually, they have the ability to infect humans and make people very sick. Besides this general reason, why else might zoonotic diseases be so important? Well, more than half of all human diseases currently known are spread by animals. In addition, it's estimated that 75% of emerging or up-and-coming diseases of people oriented with animals. And so this is important when you're listening to the news and you hear talk about things such as Zika or Ebola and some of these diseases that may start in an animal population and can quickly spread to humans as we begin to expand where we're living and how far we can travel and how quickly, for example. Zoonotic diseases can be caused by bacteria, viruses, fungi, or parasites, and this helps make them very diverse and effective agents in causing disease. So, who has the highest risk for contracting diseases that are zoonotic? And you may, of course, think of people who have a very routine exposure to animals. And that would be exactly right. Your farmers and farm workers are constantly around animals, whether it be poultry, swine, cattle, or even pets. In addition to that, other professions such as veterinarians that are constantly in contact have a higher risk of exposure and disease as well. So what we all need to realize, though, is prevention is our best defense that we have on our side. And something we can do is ask ourselves questions such as, how can we prevent mosquito bites? Which may seem kind of silly, but something such as wearing proper clothing, covering up our skin, wearing tall socks, long pants, and sleeves during those peak mosquito seasons, and using insect repellent appropriately can really help to protect ourselves from these mosquito bites, which can transmit diseases we'll talk about here in a minute. Always make sure that you understand your own personal risk. Ask yourself other important questions to assess this, thinking about when you are possibly exposed to disease, such as when was the last time you were around animals, what kind of animals, for example. Also, how are diseases spread? Knowing if it's through ingestion, inhalation, or possibly through a vector, which we'll talk about more here shortly. And know who you can talk to about zoonotic diseases. And this would include your parents, supervisors, coworkers, veterinarians, and other health professionals that would be able to discuss this further with you. So, how can you reduce your risk of spreading disease? First and foremost is one I'm sure you hear about a lot, and that's through hand washing. Make sure to do so with soap, water, and thorough drying, because this will help prevent you from transferring diseases you may have come in contact with at the farm, perhaps back to your phone, into your vehicle if you drove there, and essentially bringing them home to your family and friends. Make sure that you watch out for needles when you're out on the farm, within a barn, or even in a clinic. Needle stick injuries can transmit diseases, so if you are stuck while working with sick or potentially sick animals, contact your healthcare provider immediately. And for more information on this, you can check out AgriSafe's webinar, Don't Get Stuck, which discussed preventing needle stick injuries in agricultural settings. Remember that communication is always key. If we don't communicate with one another about a sick animal or something such as a needle stick, we can put ourselves and others at risk of getting sick or injured again in the future. So, once again, know who you can talk to about zoonotic diseases. This includes family and friends, veterinarians, doctors, and the public health department. Now, you may be wondering where you should start your conversation with these people and others in your community. And a good place to start would be, of course, at the beginning, talking about your exposure at work, what kind of animals you're around, how often you're around them. Also, if you have suspicion of diseased livestock or pets, perhaps you've noticed some animals are lethargic or walking around real slow, feeling under the weather, it may seem. If you've traveled, and this includes domestic and foreign travel, if you've traveled to another country, for example, just because you weren't in direct contact with a pig farm or cattle there, mosquitoes are a huge vector for zoonotic diseases, so it's important to let your healthcare provider know that. And as well as domestic travel. And this isn't even just within the United States still, but if you travel to a farm down the road, it's important to keep that in mind, as every farm may have different animals, different sanitation protocols, or different diseases that are present. And of course, make sure you talk about any symptoms of illness that you may be experiencing. While symptoms can vary depending on the disease and exposure, some of the most common signs and symptoms to report include fever or chills, headaches, excessive fatigue or constantly feeling tired, joint pain or swelling, as well as body aches, rashes anywhere on your body, nausea, or vomiting and diarrhea. For today's presentation, we're going to use this wheel that depicts the wide variety of animals that can transmit zoonotic diseases. And AgriSafe has up-to-date resources available for you so we can work to protect the people who feed the world. In doing so, AgriSafe has developed multiple different training modules which can be found on their website, www.agrisafe.org. One of these is focused on helping you determine what types of personal protective equipment, or PPE, you will need, especially when you cannot avoid contact with potentially diseased animals. Always remember to protect yourself by wearing safety glasses or goggles, respiratory protection, gloves, appropriate clothing such as coveralls, aprons, or long pants, and proper footwear, closed-toed shoes that are sturdy. Please also remember that PPE is not one size fits all, so it's important that you select not only the proper gear, but also the proper fit for things such as respirators, gloves, hearing protection, and safety glasses. The right PPE with the right fit depends on the specific exposure. Once again, please feel free to check out the AgriSafe website for more information on selecting the proper personal protective equipment. Proper equipment is not only the precaution you need to take, though. How else can we protect ourselves? Well, there are many ways that people of all ages can be protected by just daily activities. One example is to designate clothes for farm and ranch work. Just like chemicals, animal fluids and dust can contaminate laundry. If resources are available, it's even a good idea to designate a separate washing machine for work clothes or clean your washer after use. As mentioned before, wear appropriate working gear. This includes sturdy shoes to prevent slipping or falling within the barn, long pants to help keep some bugs away perhaps, and insect repellent as well. To touch on hand washing again, because it is the #1 preventative measure that we can use, make sure you're washing your hands diligently and really take it serious. Use your hot water, lather with soap for at least 20 seconds, dry with paper towel, and wash your hands often. Hand washing can really reduce the chance of spreading diseases, once again, not just to one another or another animal, but also bringing them home, as I know a lot of people tend to carry their phones with them on the farm. There cannot be enough emphasis on this next couple ones here, and that's to always check for cuts, scrapes, bites, ticks, and other insects. Beware of any new or developing rashes. And if you do see that you have a cut or an open wound, make sure you clean, treat, and cover it prior to contact with animals. Also letting healthcare providers know. We also would recommend wearing gloves after the cleaning and bandaging to add an extra layer of protection. Another key in preventing diseases is through vaccinations, so make sure you know your own medical history. Do you know if your tetanus vaccine is up to date? If not, talk to your healthcare provider's office to obtain a record of your vaccinations. This way, if something were to arise in the future, you have an idea of what you are vaccinated for, and you can receive the proper help. Remember that certain people are at higher risk of injury from animals, specifically younger people that may spend a lot of time around animals, and children that may not yet pick up on animal behavioral or social cues. For example, adults may tend to notice or be more aware of a horse pinning its ears back or a cow pawing at the ground when you approach, say, a new calf, which are both signs of fear, anxiety, or stress. Being aware of animals' behavioral cues can help protect us and those around you. Additionally, individuals with compromised immune systems should express extra caution when around animals. Individuals that are young, old, pregnant, or have a pre-existing condition that has compromised their immune system are more susceptible to diseases. These individuals should be very diligent with hand washing, use recommended PPE, avoid animal body fluids, and contact their doctor about exposure to animals. Now that we have gone over some basics, let's take a look at some of the most common zoonotic diseases. First up, we have cattle, which we rely on for dairy and beef products on a regular basis. A fun fact is that there are about 1.5 billion cows in the world. This means that a large number of people work with these animals on a daily basis, are in contact with them very regularly. Think of a dairy, for example, with morning and afternoon milkings. And so it's important to discuss some diseases that are transmitted by cattle specifically. First, we have brucellosis, which is caused by bacteria that can be transmitted from drinking raw or unpasteurized milk, coming into contact with blood or tissues, or through inhalation. Symptoms may not show up right away and can include fever and other flu-like symptoms. Brucellosis is also known as undulant fever, referring to the continuous rise and fall of the fever in infected individuals. The bacteria that causes this disease is Brucella, and there are different species that are more prominent within certain animals. For example, Brucella abortus is common in cattle and results in spontaneous abortion or stillbirth, sometimes or most likely on a dairy farm, while Brucella suis would be more common in swine. So there are other hosts such as swine, sheep, and goats, so just to be aware that it's not only with cattle. Next is leptospirosis. This zoonotic disease is transmitted from contact with infected urine, most commonly in drinking water sources, and symptoms include fever, a flu-like presentation, so headache, nausea, vomiting, things like of that nature, and jaundice, which is a yellowish tint to the skin or eyes that occurs from accumulation of bilirubin in the body and red blood cells being broken down. Leptospirosis may have a long incubation period, and what an incubation period is that time frame between being exposed and then starting to see those symptoms. And so it may not be right away, and as you'll see with all these different diseases, they vary depending on the organism and the agent. And so some other hosts for leptospirosis include swine, sheep, goats, and wildlife. So things such as squirrels, foxes, raccoons, rats. And so one way to prevent your own pet, for example, your dog, from getting leptospirosis is to talk to your veterinarian about the vaccine that's available and to monitor your own yard for wildlife. Also, to protect yourself, make sure you wear proper PPE, such as safety glasses, which would help prevent animal urine splash and exposure, specifically in a setting such as a dairy parlor where you may be in the pit during milking. Now, do you know what this picture is? I'm sure you've seen it out in the woods, and it's a tick. And a little fun fact there is ticks are actually an arachnid, and it serves as a vector transmitting diseases between animals and people. And so one example of a disease ticks transmit is Q fever, and the Q stands for query fever, and that's just what it was called before people knew what was causing it, before they could trace it back to these infective ticks. And so in addition to tick bites, Q fever can be transmitted through drinking raw milk or through inhalation, specifically from birth fluids, blood, or dust that has these particles. Symptoms include high fever and chills, headache, and if left untreated can develop into pneumonia. Other hosts for Q fever include goats and sheep. So those were a couple examples of diseases in cattle, and keeping in mind the large number of cattle throughout the world, it's important to express extra caution when working on, say, a dairy farm, because you are exposed and so frequently around birthing fluids, urine splash, and just the animals in general during handling. Next up on our wheel of exposure, we have deer and other wildlife that have many of the same diseases as their domestic counterparts. Additionally, hunters should take extra care when handling these animals, such as deer, because disease presence may be difficult to assess by just looking at them. Before we specifically talk about deer and wildlife, let's look at another important vector in transmitting zoonotic diseases. This is a deer fly, and along with ticks and mosquitoes, they can transmit tularemia, which can also be called deer fly fever or rabbit fever, as rabbits, as well as sheep and other wildlife, are known hosts. Transmission can occur through contact with infected urine from the wildlife or infected water. Symptoms include fever, flu-like presentation, and jaundice. One disease to note for wildlife such as deer is Campylobacter, which is a bacteria. Transmission occurs from eating undercooked meat, drinking raw milk, or consuming contaminated water. And of course, in that example of drinking raw milk, that would be from one of the other hosts, specifically cattle. Symptoms such as the stomachache, diarrhea, and fever usually appear within a couple days, and other hosts, in addition to the cattle and wildlife, including deer, would be your swine and sheep. One of the more common infections you may have heard of is Salmonella. Once again, it can be transmitted from eating undercooked meat, drinking raw milk, or contaminated water, as well as through inhalation or from infected soil. Symptoms of fever, diarrhea, and vomiting will usually appear within 12 to 72 hours. Often, pork and poultry that are undercooked tend to be the culprits of Salmonella, but consumption of unpasteurized milk could also cause this. Moving on to the next animal on our wheel of exposure is poultry. Thinking back about how many cows there are, estimated around 1.5 billion, chickens are actually the most common farm animal in the world. And by quite a bit when you look at it. There are approximately 3 chickens for every person. That means that there are not only a huge amount of birds, but also a ton of operations and more work opportunities in which people are going to be exposed to these animals. Perhaps one of the most common headlines in relation to the poultry industry that you may have heard is about avian influenza, or what people call bird flu. This avian influenza resource shown was developed by the CDC and AgriSafe in response to the most recent massive bird flu outbreak, and it's available on the AgriSafe website and through www.cdc.gov. One of the less common diseases of poultry with zoonotic importance is Newcastle disease, which is caused by a virus. It can be present in not only commercial poultry operations, but also in wild bird populations. It is transmitted through contact with secretions from infected birds and causes conjunctivitis or inflammation of the conjunctiva or lining of the eye, and sometimes flu-like symptoms. The best way to decrease the opportunity for conjunctivitis is through careful hand washing, use of gloves, and of course wearing splash-resistant safety glasses to protect your own eyes when around poultry. Another disease that may not be as commonly known is erysipelas, also called St. Anthony's fire, due to the burning sensation that the red skin infection is known to cause. Transmission occurs through contact with animal tissues or waste and ingestion of infected soil. Other hosts include swine, which we will touch on later. Another very important vector in zoonotic disease transmission is the mosquito. And I'm sure not many people care for mosquitoes, but just like ticks, it is actually only females that will take a blood meal. And this makes sense because if you think about what would a female mosquito or a female tick have to do that a male wouldn't, it's going to be to reproduce. And so that blood meal is required so mosquitoes are able to oviposition, which is their form of reproduction and laying their eggs. So mosquitoes are known for a wide variety of disease transmission processes, and one in specific is West Nile virus. While most of the time West Nile virus may not present any specific symptoms, it can have a flu-like presentation, and it is possible to get the neuroinvasive disease, which can be fatal. West Nile normally persists in a mosquito-to-bird life cycle, and humans as well as horses are known as dead-end hosts that can be severely affected. Prevention against West Nile includes using insect repellent when working outside and wearing protective clothing, as we talked about before. Next up on our wheel, we have rodents. And in this case specifically, we're referring to mice and rats. One of the zoonotic diseases they are most well known for is hantavirus, also referred to as Four Corners disease because it was first discovered in the southwest United States, where Arizona, New Mexico, Colorado, and Utah all meet. Rodents shed the virus in their urine, feces, and saliva, and it's transmitted to people through inhalation. When cleaning out a barn, for example, you should take extra precautions, as sweeping and disruption of nesting materials can increase your risk of exposure. Symptoms usually occur anywhere from 1 week to over a month from exposure and include fever, dizziness, nausea, and vomiting. Hantavirus can result in fluid accumulation in the lungs and develop into hantapulmonary syndrome, which can be fatal. Back to one of our most important vectors, the tick, we can now talk about Lyme disease, which I'm sure a lot of people associate with its known bullseye rash as seen in the picture. It is named Lyme disease after where it was first discovered in Lyme, Connecticut. And with something that's interesting is the deer population tends to be one of our most common reservoirs, but rodents should also be noted, and your pets can also get it. Moving on around our wheel, we get to the horse next. And while some people may not seem to think of a horse as being a reservoir for disease, they absolutely are. And one of the most common ones I want to talk about is tetanus, which I think a lot of people usually ask themselves, how else can you get tetanus? And your answer to that would be, oh, stepping on a rusty nail, maybe catching yourself on a fence. And this is why it's so important to talk about tetanus with your healthcare providers and making sure you're up to date on vaccinations. Anthrax is another Back to focus on zoonotic diseases, horses as well as other animals can transmit anthrax. Transmission may occur from animal carcasses, inhalation of spores, or through contaminated water. Symptoms include cuts or bumps on the skin, redness or itching, and trouble breathing. These symptoms need to be reported immediately because anthrax is a bioterrorism agent, and in 2001, it was put in letters and mailed out in the United States, resulting in 22 people getting sick and 5 people dying. Looking back at the mosquito and some of the diseases it may transmit, horses are a known reservoir for many different encephalidae, which cause encephalitis, or swelling of the brain. Symptoms include headache and flu-like presentation, so it often goes unreported or undiagnosed. In addition to being rather vague symptoms, they may not show up for about 2 weeks, and headaches may even resemble migraines at first. Often, diagnosis for encephalitis requires brain imaging such as MRIs, CT scans, and even a spinal tap for culturing. We are now over halfway done with our exposure wheel, and next up we have cats as well as other domestic pets, such as our dogs we may have. Cats in particular can have something known as ringworm, and contrary to its name, ringworm is not actually caused by a worm. It is transmitted from contact with infected animals or contact with feed or waste, and symptoms may not appear for 2 weeks, but include itchy, red raised patches on the skin, and other farm animals may be a host. So, if ringworm is not caused by a worm, do you think ringworm would be caused by a bacteria, virus, fungi, or protozoan? You may have had a bit of a sneak peek of our hint here being the mushroom, but it is caused by a fungus. It is not caused by mushrooms. That's just to help us show that it is caused by a fungus, but itching can cause a secondary bacterial infection. Next, we have amoebic dysentery, which is another zoonotic disease of cats and dogs, and it can be transmitted through contaminated food or water. It results in vomiting or diarrhea as this contagious amoeba infects the colon. Now, we will talk about bats. Bats are absolutely amazing at eating insects such as mosquitoes, but they too can carry diseases. So we're going to look at 2 in specific today, the first being rabies. Rabies is a virus that has an incubation period of anywhere from a few days to up to 3 months, and it is transmitted through the bite of an infected animal or contact with the infected tissues. Symptoms include headache, salivation, difficulty swallowing, and fever. And while we may think of bats as the main host for rabies, other mammals, including wild animals and pets, can be hosts. In fact, only a small number of bats have rabies. However, a majority of human rabies cases do originate from bats. And so this is why it's important to never approach or touch wildlife such as bats that you may see around your house or out at the farm. The second disease I want to touch on today is histoplasmosis in regards to transmission from bats. Histoplasmosis is transmitted through the inhalation of fungal spores from feces, and it is most commonly contracted when cleaning out barns, old buildings, or poultry houses. So another host would be birds. For this reason, it's important to wear your proper PPE, in this case, such as a respirator. And last but not least, today to talk about, we have swine. Pigs are very similar to humans in different ways, and it makes them a very important player in zoonotic diseases. One disease in particular to swine, as well as cattle, is tapeworm and trichinosis. This is most commonly caused by eating infected, undercooked meat, and it can have that characteristic of what people will say is crunchy pork. It's almost like if you were to bite into it, something is popping within that pork or that bite you just took. It can result in fever and flu-like symptoms, but the presentation can be short-term, appearing within a day or two after ingestion, or lasting up to 2 to 8 weeks. So it is important to note that this is not only for consumption of domestic swine, but also wild pigs that may have been hunted and prepared to eat. For this reason, make sure you always wear non-permeable gloves and use strict hand washing techniques when you're in contact with potentially infected meat or materials that are present. Hepatitis E is another disease of not only swine, but also deer that affects the liver. It is transmitted from drinking water that is contaminated with feces or eating uncooked or undercooked meat. Symptoms may not appear for up to 6 weeks and may include fever, stomach pain, or jaundice. Previously mentioned when discussing poultry is erysipelas. This is transmitted from contact with infected tissues, waste, or infected soil, and this disease results in symptoms of fever and chills, internal pain, headache, and skin lesions. In swine, erysipelas is a skin infection. And just to close out our zoonotic diseases that we've touched on today is swine flu, also known by the specific strain names H1N1 and H3N2. Like the typical flu, swine flu is transmitted by exposure to infected animals or contaminated environments, and symptoms include fever, coughing or sore throat, chest and stomach pain, as well as vomiting. So as a quick recap, can you think of another common animal influenza? In which we only talked briefly about it before, but that is the bird flu, which would also present with the same symptoms. And so the specific strains associated with avian influenza or bird flu include H5N1, H7N9, and H9N2. Just as a fun fact, the H and the N in the specific strain names are in relation to two specific proteins on the virus. H symbolizes the hematogluten, and N is the neuraminidase. And both of these are required and essential for the virus to be capable of infection. And so the numbers just signify essentially what version of the protein is present, making each one a little bit different than the past. So one more quick look at the AgriSafe Zoonoses wheel, and I just want to remind you again how human, animal, and environmental health are so closely connected, and it is our job to make sure we're protecting ourselves and others, managing our risk, and doing our best we can each day. As a disclaimer, this material was produced under a grant from the Occupational Safety and Health Administration through the U.S. Department of Labor. It does not necessarily reflect the views or policies of the U.S. Department of Labor, nor does the mention of trade names, commercial products, or organization imply endorsement by the U.S. government. Additionally, everybody has the right to know about the OSHA whistleblower statement that protects the employee's right to freedom from retaliation. The OSHA Right to Know also provides additional OSHA information on employees' rights and protection. For more information, you can visit OSHA's website or AgriSafe. And with that, I would like to thank you for your interest and attention for the AgriSafe Zoonotic Disease webinar. And if you have any comments, questions, or concerns, please contact the AgriLife staff. Thank you.